use the same technique of positional release onto the lower back. I will start with the draping, yeah? So you put a pillow in between the client's leg, and then nicely doing the same trick with a pillow, with a towel, of holding it nicely in here. Great. Can you tuck this part underneath and then take this arm outside, yes? And you can tuck it a little bit more. Good. So now the lower towel is secure, and if I want to do, all I need to do is actually kind of just roll it, and I have that lower back. So you need to come from the back, and I'll show it to you again. Yeah. So the lower towel is tucked like we usually do. The upper towel is tucked underneath, and you might use their hand to just cover the area that we need to work. Yeah. Okay. So you can do effleurage, pétrissage onto that area, but sometimes you want to use the same trick of making the muscle shorter and longer, yeah, all the time. Now, if you work on both sides, you need to kind of traction these two muscles. So you need to do it this way. Remember that technique? Yeah? Great. Let's add on to it. So what you can do is use the hip to actually move and shorten that muscle. So look at that. I'm holding now the iliac crest, and now I'm stretching it, and now I shorten it. Yeah? You might need to have the legs there. So it really works together. So at the beginning, I just want you to control the hip. Yeah? Move it a little bit, move it upward, and then move it downward. When you move it upward, you're using the greater trochanter. You're using the femur. Yeah? Yeah? But you have a nice control lever. You can even do some sort of oscillation.
Is it good for someone with what's it called,
sciatica?
Yeah.
It depends. It may be contraindicated on acute level to do that. Yeah. Okay. But actually now you kind of do some more oscillation to that area. How does it feel?
Yeah, it's quite relaxing.
Yeah. Okay. But now you want to work more specific on the quadratus lumbarum muscle. So you put your thumbs there and you're finding it. Now how to find that? You go from a more superficial, the erector spinae muscle, and then you're looking to get a sense of a muscle, and then it's kind of disappeared. Right, so now I'm in the more abdominal area. So I go backward, and the first one that I feel, this is quadratus lumbarum. So then I work on that muscle while put it into laxity and then stretching it.
So you start gently.
It's tender. Yeah.
Why would it be tender? Because she's tight. It's tight.
Because usually it's a tight muscle, it's a deeper muscle, so it's holding a lot more tension. Okay? And you can do the same thing for the erector spinae muscle. You're putting your hands there, and then, so it's not only massaging, but actually helping with the hip, and then tractioning it, and then helping with the hip. So working on the pumping effect. Traction. On the hip. Yeah. Okay. And then try to do it differently. I don't know, maybe a bit more side to side. So you just encourage the nervous system to work in a different way, to get a bit more relaxed. And you never know, you may find something that would release it and no one else did before.
That's really good.
So instead of working just up and down, you're working on the rotation. So this hand go that. So I'm holding the hip, moving it, and then the other hand move on the other direction. And then the opposite.
So for people with lower back pain, this would be good.
Yeah. On a chronic level, that would be fantastic.
Okay.
More than what they can expect.
Yeah.
But you need to tell them, look, on the relaxation, you might losing here an opportunity to help you. Yeah. So you need to get it going because they don't think that massage can do it.
It is quite hard sometimes for the back knowing what to do because I sort of feel like I run out of things to
True.
do for it.
Yes.
So,
Play with it, really. You have to be creative within domain of what allowed and what not allowed to do physiologically. You don't want to do things too quickly, yeah. Yeah. So again, starting with some oscillation, you can relax that area, and then putting the muscle into compression and stretching it. Still pressing, it's like compression with movement. And then move with it. Compressing even the lower ribs. Yeah, I'll do that here. Lower ribs, you can compress them a little bit. Yeah, it's a bit of coordination because you have to do two things with two hands, yeah? Shall we start? Yeah?
Yeah.
Cool. Good.
Jane, maybe the rest of you already prepared.
Stay.